Hi, I'm Dr. Martha Calihan from Five Stones Wellness. So, we're going to continue this discussion of stress and talk about how it can affect our bodies, our physical bodies, to start with. As we were talking before, the stress response is hardwired so that the physiology, the chemistry of stress happens with a stressful situation. But the degree to which that impacts us is more of an individualized response. So when we were talking about the stress response and what happens when we're threatened, the heart rate goes up. You feel that sort of tightness, anxiety in the chest. You get that kind of butterflies in the stomach feeling, your mouth gets dry. What's really happening there is that the body is, I like to say, diverting resources to what we need. We might need to run, so blood flow actually is going to preferentially go to the big muscles like in the legs so that you could run if you're being threatened. And if you're being acutely threatened, you don't really need to be digesting food at that moment. You don't really need to have your reproductive system working as well, or your immune system, because the issue of the moment is survival. So when we shift into that stress response physiology, some of the other consequences of that are decreased function in those other organ systems. And that's fine if it's an acute threat and it goes away, and then the physiology goes back to normal. But what about all of us who live in this chronic condition of chronic stress? So many of my patients are dealing with this, and they're stressed from multiple sources all the time. So instead of that stress response happening and then resolving, they stay in this perpetual state of stress response. And then you can imagine what happens to the physiology in the body. Digestion isn't working optimally. So what happens? People get reflux, heartburn, irritable bowel syndrome symptoms. All of those things that can be because of a shift in the physiology contributed to by stress. I see a lot of people with immune system dysfunctions, I'll call it, probably predicated on stress response. Same with reproductive issues. And you think of all the people struggling with fertility issues. I think that a lot of that probably has its roots in a stress response and how the body is responding and choosing to use its resources. One of the frustrating things for so many of my patients is that they have seen other physicians, other practitioners who have basically dismissed their symptoms as all being stress-related. In a way, that might be true, right? There's a stress component to a lot of our symptoms. But I don't think it's fair to just dismiss them as that. Far better to understand that stress response, why it's causing the symptoms it's causing, and then learning some tools and some ways that we can actually change that response or change the effects of stress chemistry in our body. I'm going to talk about that in the next video.